Well, thank you all for joining my presentation today. I am Dr. Candace Benali, and we'll be talking about clinician-parent relationships today. And so we'll focus a lot of the time on different strategies and practices for supporting parent engagement and communication when we're providing mental health services for kids. So again, I'm Candace. I am a postdoctoral fellow here at UCEBT. I completed my PhD in psychology from Utah State University with a specialization in school psychology. And I completed my predoctoral APA accredited internship at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. And I really focus a lot of my career and my clinical practice on early childhood, particularly early identification of autism and assessment of autism, and also other psychological evaluations for things like ADHD and other neurodevelopmental disorders. And I also have an interest and a specialization in working with parents and caregivers for like disruptive and challenging behaviors, particularly using behavioral parent training. So that is kind of the background and my interests. And so a lot of these things that I have focused on really engage parents. Like parents have to be engaged in participating in order to be involved with evaluations and early identification, but also working on a lot of those challenging behaviors that some children experience. So just a couple things before we get started with the presentation. So with accuracy, utility, and risk. So this presentation discusses the research regarding factors influencing parent engagement, evidence-supported strategies for increasing parental engagement and outcomes of parental engagement in the service provisions of children and adolescents. Misapplication of the strategies could result in poor outcomes. And then I am not aware of any conflicts of interest that I have, and there is no commercial support for this. And so before I get into the agenda, I just want to encourage you all to post any questions that you might have in the chat. There will be a few opportunities throughout the presentation where I will ask you some questions. And I would encourage you to post that in the chat. And I will be watching the chat throughout the presentation. So our agenda today, we're going to talk about what is a clinician-parent relationship. Also, why is it important that there is a effective clinician-parent relationship and the importance of parental engagement when working with kids. We'll talk about the factors influencing parental engagement as well as their motivation to engage, and also the outcomes of parental involvement. And then most importantly, we will also talk about strategies for increasing communication and engagement, as well as ways to measure engagement. Okay, so before we get started, I would love everyone to post in the chat, like, what is your role and context when engaging with parents and caregivers? For example, do you primarily do it in a school setting or in a therapy setting, potentially in evaluations? I would just love to kind of see where everybody is at. Lots of therapy settings and assessment, private practice, child's therapist, DCFS. That's a really important one that I don't think I was necessarily thinking about when preparing this presentation, but I definitely, the strategies apply to all of these settings that everybody is putting in the chat. Lots of therapy and psychological evaluations. Elementary school setting. Love seeing teachers and other school professionals here as well. Okay, Thank you all. That is really helpful for me. Then I can help to tailor things specifically to the setting that you're working in. Okay, so what is a clinician-parent relationship? So the definition that I came up with when I was thinking about this is that it's a collaborative and supportive relationship between the child service provider and the parent caregiver in order to encourage therapeutic progress. And so I put therapeutic progress, but I don't think that that is necessarily like all encompassing. It's really just like any progress, any way to help support the child in the things that they're needing. So when we're thinking about this relationship between caregivers and service providers, I think it's really important to understand the responsibilities of everybody involved. So with parents, some of their like main responsibilities with this are initiating services, bringing their child to these service provisions, so therapy, meetings, those sorts of things, so encouraging that attendance. Also communicating what their family and what their personal needs are. If we're not aware of what they need, it's hard to provide effective services and support for the family. Another responsibility is them being present in sessions and in these meetings, as well as the parent is really a huge role in providing support and encouraging generalization of skills and strategies and different things to support the child at home. And then on the clinician side of things, we're providing structure and evidence-based recommendations and strategies. We also provide support, like especially emotional support for families. And it's also our responsibility to include parents as well as other family members in the services that we provide. Sometimes you'll have parents and caregivers that really ask and insist that family members are included, but that's not always the case. And so sometimes it is a very big responsibility of ours to encourage it and to ask family members to be present. And so I asked you all for like what roles and contexts you provide support for children and families. And so this is just kind of what I put together for like roles and contexts of what we often see people involved with families and children. So we talked about individual therapists and just therapy in general, assessment evaluators. There's a lot of school personnel that are involved with families and children, whether that's teachers, school psychologists, school counselors, even just administration. They're all very heavily involved with parents and caregivers and the children. Also, just being in the role of a consultant is a role in a context, as well as there's definitely several other roles and contexts that we can provide support for families and children. So what is the importance of the clinician and parent relationship? Why does this matter? One of the big things is having parents involved helps to support collaboration and engagement. And some of the key pieces here are parents support children in attending the services to even receive the skills and strategies. And so if parents are unable to bring children or encouraging them to come, that definitely limits our ability to provide services and strategies to children. And then offering opportunities for parents to engage in service provisions is really important. The more opportunities that we offer, the more that they're available to be collaborative and to engage and to apply these different skills and strategies. Parent attendance is really important. And when I say parent attendance, I don't just mean them physically being present. I'm sure we've all worked with a lot of children and families, especially in a therapy context, where parents stay out in the waiting room. They're there, they're physically present, but they're not necessarily engaged in session. They're not being included in activities or discussions or being provided any homework. And so parent attendance is really important for supporting that collaboration and engagement. Another reason why parent engagement is so important is for the generalization of skills and strategies. Parents are really the expert in their children. They're around their child more than anybody else is. We might see a child for like a good chunk of time when we do assessments with them. So maybe like a few hours, or if we're seeing them for weekly therapy, then we might see them every week for an hour. In the school setting, you might only meet the child once if you're like a school psychologist or school counselor, if you're not providing regular services. And so parents have access to the child a lot. And so it's extremely important to include them in order to support that generalization of skills. They are a great resource for promoting skill acquisition and having them encourage children to implement different strategies at home, as well as parents implementing strategies. So if we're working more on behavior, then parents play a big role in implementing parenting change. Also, when we work with children, maybe weekly or less often even, we can't always provide in the moment feedback. And so parents and caregivers are there to provide that in the moment feedback that we can't always do. Parents also offer a lot of perspective and insight into their kids. We might hear one thing from children, we might observe things in the classroom or in other contexts, but parents know what's going on at home. And oftentimes we don't have that ability to see everything that's going on at home. And most importantly, parents offer that bridge between home and the service provision, whether that's in a therapy session or in another context. And so they really help to bring those strategies home. They help to generalize skills. They help to encourage kids to implement different things. They're really that bridge, and that's why they're such a key piece of this. Another important reason to encourage parent engagement is that it supports a systemic approach. And so we know that when we're working with an individual, that individual's concerns and problems aren't always just related to them. There can be a lot of other things going on in their life, at home, in different contexts that aren't always something that they can address individually. And so different pieces of the system, like how's the family structured? What are there are there siblings involved or other caregivers? How is the family structured? And how is this providing support or hindering support? Parenting style is also a big one. There are a lot of different parenting styles, and there's pros and cons to different approaches to parenting. And so by understanding that parenting style, we can better support the kids that we're working with by helping parents to utilize their skills and strengths. Socioeconomic status can also really impact the system. Are there different stressors going on at home because of finances? Or what else is going on, that other factors that could be going on, or other stressors going on that can impact the child as well as the entire family system? Culture and diversity. Every family really has their own culture. And also include thinking about diversity with race and ethnicity, as well as gender minorities. That all can play it can play a role in that family system and how that child is interacting with the system. And lastly, social support. Children and families have different levels of social support. Some people go to church and have that large community, others don't. Maybe there's a lot of family around who provide a lot of support, or there isn't a lot of family around. And so these are all different pieces to the overall system that's really important to address. And so by including parents in our services, we can better understand the overall system and all of these other factors that can be impacting children. Okay, so we talked a lot about the importance of encouraging parent engagement. And so let's talk about some factors that might influence parent engagement and motivation for the positive as well as potentially negatively impacting engagement and motivation. So the way that I think of this and conceptualize it is when we're thinking of these different factors, there are clinician factors, so things going on with us personally, our personality, et cetera, that can influence engagement, as well as child factors, parent and caregiver factors. The parent-child relationship also plays a big role in encouraging parent engagement and motivation, as well as therapeutic alliance and parent clinician relationships impact it as well. So these are some different clinician factors that could influence our relationship with parents and caregivers. So one, like how much access and availability are we providing to families? Obviously, we all need to have our own boundaries and respect like our personal lives. And so I'm not saying like be completely available 24/7 to parents. But this might something that we might think about is, are we having to cancel sessions, or is the session time that we have scheduled with families not accessible to them? And so just thinking about access and availability. Providing the amount that we're providing opportunities for parents and caregivers to engage in our services is really important as well. Some parents will take initiative and request that they're really involved, but they may not have the knowledge or understanding of why it's important for them to be involved. And so providing them lots of opportunities is really important to encourage that engagement. And then on the flip side, if we're not providing those opportunities, then it can make it really difficult for them to be engaged and motivated to work with us. Our own anxiety can impact it. A lot of clinicians who specialize and work with children can often be uncomfortable working with parents and adults. And so just thinking about like how are you reacting to parents, and how are you able to kind of reduce some of that anxiety that you may have when working with them. Therapeutic listening, for example, making sure that we're listening to families about their needs and concerns, making sure that we are accurately understanding the primary concern and providing accurate diagnoses. And so just being available helps to develop and maintain those good therapeutic relationships. Rapport building is really important. We know that when working with kids, and so it's the same with working with caregivers and parents, is making sure to like give them that time to build rapport and trust with us will help to encourage that engagement and that motivation in a positive way. Personality characteristics play a really big role. We're all different. We all have our strengths and weaknesses. And so being aware of what the strengths and weaknesses are is really important. And so different characteristics have come up in the literature about what encourages engagement and communication with parents. So providing trust, being warm and empathetic, being accepting and honest with parents. Those are all personality characteristics that have been shown to really encourage engagement and communication. Things that don't encourage engagement and communication as much is being rigid, being overly critical, being being less involved, could all be a hindrance to therapeutic alliance with parents. Providing emotional support is another important part of encouraging these things. So the literature has found that parents are more engaged and willing to apply the different recommendations and strategies that we suggest when they feel valued and heard. Also just like normalizing the situation by adding humor into things can be really helpful for providing that emotional comfort. Using those reflective and active listening skills, like repeating what we think we're hearing from parents. That's always a great way to make sure that we're hearing them accurately and correctly. And they can always correct us if we're wrong. And so those are all really important things for providing emotional comfort. Another factor is parent-centeredness, or patient-centeredness. And so really helping parents to like build confidence in their parenting and supporting their child, as well as encouraging trust and building trust, and providing unconditional positive regard are all important factors to keep in mind for clinician factors. Now, with parent factors, because parents also there's two sides to every relationship. And so there's clinician factors, and then there's also the parent factors that are playing a role in this relationship as well. And so different family characteristics can play a role, such as parent age. The research has shown that the older parents are, the less engaged that they might be. And so these are important things to keep in mind, where we might need to really work on those skills and strategies a bit more to encourage engagement. Parental role plays a piece. So the research has shown that fathers are often less involved in therapy. And so, and that could be for a number of reasons. That could be because they have other responsibilities that they're trying to take care of, or maybe there's a bias on the clinician side of things. And so making sure that we're offering those opportunities to all caregivers involved so that they feel included. Parent personality plays a role as well. Similar to what I was saying before about our own personalities, it's important to consider, what is this parent and caregiver like? What is their personality like? And what are their strengths and weaknesses? And how can we use that to encourage communication and engagement? Socioeconomic status plays a role. Economic stress and other stressors play a role in families being able to be involved. So for example, if there's a lot of other stressors at home, or in their like larger system, they might feel that there's too much going on. And so it feels extra stressful for them to engage in therapy with their child or in other services with their child. Single parenthood also plays a role. So if we have single parents that are bringing their kids to therapy or other services, they often have a lot of other things that they're juggling that they may not have other social support to help them with. And so it can also impact their ability to engage. Different family processes, such as parental mental health. So there's research to support that when parents are experiencing mental health challenges like depression and anxiety, it's much harder for them to engage in these services. If there's other relational conflicts going on, or the relationship quality with other caregivers or their child or other family members can also decrease engagement. If there's a lot of household chaos, so if there's other children that are experiencing other challenges, or there's just a lot going on at home, it's much harder for parents to engage and provide that support. And also current parenting skills and strategies can impact their engagement. For example, if what we're suggesting is very different from how they have parented previous children or the child that we're working with, it might be really hard for them to get on board with these strategies. Some contextual influences impact it, such as like their beliefs about parenting roles, different cultural factors, such as having different beliefs about what they expect of their child, plays a big piece in cultural expectations. What are their help-seeking beliefs? For example, if they haven't believed in therapy in the past, or they've been really resistant themselves of seeking out therapy, or different mental health services, can make it more challenging for them to engage. Another big one to think about is like, what is their readiness to understand their child, to understand what's going on, and to apply these different recommendations and strategies. And then general motivation plays a big role. And I think motivation is encouraged by a lot of these other factors as well. And then also their locus of control related to their child's issues. So what are the parents' attitude and perceptions of themselves when engaging with their child and their child's challenges? So in addition to clinician factors and parent factors, child factors also play a role in engagement. There's been research to support that as children get older, the parents' participation often decreases because they don't believe that they're playing as big of a role anymore, and it's more on the child at this point. So this is like in the realm of adolescence, when parents are starting to believe that kids should be more independent and be doing these things on their own. Also, the level of impairment or challenges that kids are experiencing can create a lot of caregiver strain. And so as the caregivers are trying to balance all of these things, there's a lot of competing demands, and their resources are depleting. So resources being their own patients could be depleting, as well as just other resources. Financial resources are depleting, emotional resources are depleting. And so the more challenges that a child is experiencing, the less engaged a parent might be, because it's just a lot harder because they don't have as many resources available. Parent-child relationship is really important to consider. So if there's a strained relationship with parents and children, parents are often more resistant to therapy suggestions. In these situations, pointing out the conflicts between parents might not always, or between parents and children might not always be beneficial. Because they might not be emotionally or mentally ready to receive these suggestions because of the exhaustion that they're experiencing. If there is a history of abuse and neglect from parents, we really want to consider, is the engagement of parents going to be beneficial at this time? It might need to be deferred until other things happen to make sure that that is no longer happening, and that other things that were contributing to the abuse and neglect are being taken care of. Other external issues impacting parent-child relationships might be family and marital problems. If parents are misusing drugs or there's other mental health concerns, we might need to put engagement on hold until they're able to address those personal challenges that are going on. And this is really important because when parents have unresolved challenges and problems, it's really hard for them to meet their children's needs because they have a lot of needs themselves. And then the parent therapist relationship or a parent and service provider relationship. Oftentimes, therapists can be the target of blame for resistant parents, and so that can impact the relationship because we're struggling and we're having a hard time being blamed. That's not fun for anybody. It's really hard for any of us to be experiencing that. When there's a lack of trust, parents might be more resistant to implementing strategies at home because they aren't necessarily bought into the strategies that we're suggesting. And there might even be a lack of trust about the general child therapy process. They're unsure if this is something that's helpful or beneficial, or they're unsure about the specific approach being made. Okay, so I've done a lot of talking so far, and so I am curious about what factors have you observed to impact parent engagement? So maybe these are factors that you've noticed have helped support engagement and communication, or maybe some factors that have negatively impacted engagement and communication. So feel free to post your response in the chat. So setting the expectation from the very beginning, I think that's really important. And so we'll talk a little bit more about that because as clear as we can be with expectations, especially from the beginning, then parents know exactly what to expect, and that definitely helps support trust for sure. Reminding that parents are the expert in their child and inviting them into the process. I love that. I think parents often start to feel like they don't know their child at all. And so that's why they're coming to us. And that's great. And I want to help. And they are the expert in their child. They know a lot about their child. And the more we support that, the more trust and confidence that they can have to implement those things. Oh, I like this. So setting up the therapy office can really impact. Yeah. I'm curious if anybody has any like specific thoughts on how would you set up the therapy office to be inclusive? Yeah, when parents believe in therapy from personal experience, they're often really bought into engaging in service for their children. Yeah, treading lightly if parents are resistant, have strong views. We'll talk more about that for sure, because that's definitely a difficult one. But yes, you're right. Treading lightly and being strategic about how we talk to them. Yeah, negative factors would be parent schedules and willingness to engage. Yeah, parent scheduling plays a big role, especially with older kids where they're starting to think like they kind of need to handle this on their own. Normalizing the experience is really important. Yeah. Thank you all so much for putting your thoughts in here. It's helpful to hear from other people about what's been helpful and what hasn't been helpful. I do want to go back to one other question that I saw at the beginning that I didn't address. So you said, how do you think these factors shift from children to teenagers? So I think one of the ones that I mentioned was with younger kids, parents are often more motivated for engagement because they see that the younger kids need that support. And with teenagers, they might be more exhausted, honestly. And they're like, well, take care of my kid, figure this out for them. It's their responsibility to apply these things. And so I think that's one of a really clear thing that happens between children and teenagers with parent engagement. I think there's a lot of strategies that we're going to talk about that definitely apply to both, but the way that we go about them might be a little different. So we will keep going, and hopefully that question is answered a little bit more in a moment. Okay, so outcomes of parent involvement. So these 5 pieces have been noted to be best practice for child mental health. And so screening and assessment, psychosocial intervention, medication management, youth employment, and parent engagement. And so the research supports that parent engagement is key for child mental health. So some different outcomes when we have parents more engaged in child mental health services. The quality and the effectiveness of services often increases and improves. General clinical outcomes often improve, such as functioning and symptom severity. There's often stronger treatment engagement with the kids, because if their parents are involved, they're often more motivated to be engaged. We often see an increase in positive and supportive parenting and a reduction in harsh and negative and inconsistent parenting. And there's often increased program participation. So kids are attending, parents are attending, homework is being completed more often, parents and kids are more involved in the discussion. And so there's a lot of really positive outcomes that come from parent engagement. What outcomes have you noticed with positive clinician-parent relationships and increased parent engagement? So have you noticed any of the outcomes that I just said, or are there other things that you've noticed when there's more of this positive relationship and engagement? And feel free to put that in the chat. Yes, the child improves. Exactly. That's usually the clear one. Something improves. There's progress in some way. What about, have you noticed that there's more homework completion on the parent side or the child side? Or maybe attendance was really poor initially, but the more that you engaged parents, attendance became a lot better. Oh, parent empowerment. I love that. Two people said that at the same time. Yeah, when parents feel empowered, they're often more engaged. And when they're more engaged, they feel more empowered. Definitely. Yeah, I love that one. Teens feel safe talking about hard issues with parents. I think that's a big one. Kids and teens are a lot more willing to talk to their parents when this engagement and communication has been modeled in session, and they've noticed that in session they're more safe, and so they're more likely to do it outside of session. I really like that one. Thank you for pointing that out. Okay, so let's talk about some more specific strategies. As we've talked about factors and some of these other things, definitely there's some strategies that have been implied, but let's talk about this more specifically. So, something in the literature is the self-determination theory, and this describes how motivation and engagement are facilitated through satisfaction of 3 basic psychological needs for autonomy, relatedness, and competence. So some things with autonomy, when autonomy is encouraged, there's often more intrinsic motivation from both parents and kids. And so everyone starts to feel more ownership. They're taking ownership of what is going on with the child as well as themselves. Offering a freedom of choice and giving choices also encourages independence and autonomy with parents and kids. And so some more specific things that we can do to encourage this are providing meaning rationales when we're discussing different recommendations. So making sure we're bringing in specific examples from the family, acknowledging negative feelings and maybe some resistance from implementing strategies, can really help to build that alliance with parents because they feel understood. Using non-controlling language, as well as providing like nurturing and motivational resources for parents. One thing that I've noticed with my own practice is sometimes parents struggle to hear things from me specifically, but when I have offered books to them and they've been really engaged with reading those books, they've found that autonomy to implement these strategies. And they've kind of, even though I may have said it before, they read it and then they find it more meaningful and they're like, "Oh, that's how I can apply it, and this is how it applies specifically to my situation." Collaborative goal setting is really important for encouraging autonomy. So working with parents and kids to create service goals um, really helps everybody to be involved and them to be expressing their autonomy and independence. And then that also just helps to encourage having some ownership in this. Being and It's also helpful for people to be involved or parents to be involved in choosing different therapeutic activities or strategies that are going to be discussed, and that also encourages autonomy and ownership. Relatedness. So this is all about that connection and partnership with families and with parents. The more connected that we can or that we can be with parents, that relatedness is going to be encouraged and they're going to feel more supported. We've talked a lot about therapeutic relationship and alliance that encourages relatedness. So this is helping parents feel cared for. Rather than them feeling like an outsider. Building rapport is really important for relatedness. So we all know that working with kids and teens can often be a challenge. And so we know that building rapport and spending that time with the child themselves is very important for them to actually implement strategies and have trust with us. And so the same is with parents and caregivers. We need to spend that time building rapport with them in order for them to feel related and be willing to be engaged and implement different strategies we're suggesting. And then setting collaborative goals also encourages the relatedness, not only the autonomy. And then competence is all about the confidence, like encouraging parents to feel like they're mastering something, they're addressing challenges, they are confident in implementing different strategies and helping support their child. And a big piece of this is working with parents to not only be collaborative with goal setting, but also be creating achievable goals. And so we might need to start with lower expectations with goals in order for parents and kids to feel like they're actually achieving goals, and that helps to encourage that confidence. And then that goes along with experiencing success when they meet their goals or they're doing something that is supportive, then they're experiencing some sort of request. And then a part of competence is also helping support families and feeling comfortable communicating their concerns and their aspirations. Okay, so I see that there is a comment in the chat. I'd love to hear any book titles you recommend to parents of young teens. Presentation is Angry Outbursts at Home. I do have some suggestions, and I am really sad that I didn't put that in the PowerPoint slides. I should have. If I don't remember at the end of the presentation, send that again, and I will list off some book suggestions that I have. Okay. But great question. Okay, so some early strategies that are really helpful for encouraging communication and engagement. Some of you mentioned this in the chat earlier, um, but making sure that we're addressing parent schedules is really important. So addressing some of those like practical barriers. So scheduling as well as transportation. I've experienced a lot of challenges with even working with families when they have challenges even physically coming to session. Or maybe there's like technical difficulties with getting on telehealth or something like that. And so working on those practical challenges early on so that we don't have to worry about it later um, is really helpful for encouraging engagement. Also addressing parent and caregivers' attitude towards therapy. So addressing their beliefs about the treatment process, expectations that treatment will be helpful, and motivation to participate. So with this, really setting those expectations clear from the very beginning is really important. And somebody had mentioned that in the chat before. And so thinking about like, what are your expectations? And so what does parent engagement look like for you in the service that you provide? In a therapy context, are you planning on meeting with parents for the last 10 to 15 minutes of every session? Or is it that you're replacing an individual therapy session with a family session once a month? So making that really clear and discussing that with parents from the very beginning. And then some therapy techniques early on and throughout to use are some motivational interviewing. So using those skills of validation, reflection, paraphrasing what you're hearing and allowing them to respond and even allowing them to disagree with you. I've noticed sometimes if I don't specifically ask families or even kids if they agree or disagree with me, they won't say it. They'll sit there and nod along with me, but they actually don't believe in what I'm saying, but I don't know that. And so asking explicitly can be really helpful. And then other techniques are addressing the whole family system and other stressors that might be going on. And we talked about that a little bit earlier. Okay, so building the therapeutic reliance is key with encouraging engagement and communication. And so I mentioned earlier, really focusing on that rapport with parents is really important, especially from the very beginning. And so making sure that we're prioritizing the relationships from the very beginning is more effective than being reactive later in the therapeutic process. When they're not being engaged. And so make sure to give that time to families to build that rapport, just like what we often do with kids themselves. And it's important to do this before we start to disseminate strategies or give recommendations, which can be really difficult because sometimes when we're working with families, they come in saying like, what are the strategies? What are you telling me? Or what do you want me to do? And it's sometimes really difficult to kind of slow it down and prioritize that relationship before jumping into giving them strategies. And if there's limited trust, we can provide some mild counseling for parents. Sometimes this is a little bit of a gray area for clinicians because we often think like, well, we're working with a child. Like if the parent needs their own therapy, we should be referring them out to like get to address some of their own concerns. And I would agree with that to an extent. And we do need to address some of those things in session. It may not be where we're providing an entire therapy session to the parents, but we can provide some mild counseling by providing some emotional support. So reflecting their feelings, communicating with empathy, avoiding power struggles, and helping parents feel heard and understood. Okay, so there's a question about how do you balance the alliance with the child versus alliance with the parent when this is an extremely strained parent-child relationship? This is a a big challenge, that's for sure. Um, and I think how I have addressed it before is really using those reflective listening and validation strategies and motivational interviewing, and trying really hard not to take sides. But when talking with parents and kids, making sure that they both feel heard, that their feelings are valid, and then the behaviors can be addressed at a later point. But I think helping them to all feel heard helps to like balance that alliance with the child and with the parent. But it is definitely a challenge, that's for sure. Okay. So some strategies for family approach when encouraging engagement. So encouraging families and parents to be sharing their opinions and encouraging them to ask questions. Sometimes I feel a little repetitive throughout session where I constantly am saying, "Do you have any questions?" And they're like, "Nope, I still don't have any questions." But at least it gives an opportunity for them to talk, even if they don't need to ask any questions. And being really creative with the questions that you ask, for them to feel like they can express their opinions. Um, Also encouraging them to provide their point of view. So, what are solutions or things that they have done in the past that worked or didn't work? What is their view on the current concern or problem? Really encouraging them to be in parents and caregivers to be involved in the therapeutic activities. So engaging them in role play or games, even like with their children. It doesn't have to be just you talking to the parent. It can be all of you together, practicing some role play, especially if there's communication challenges between the parent and the child at home. I feel like teens and kids can feel really empowered when that communication can be modeled for them and they know how they should respond to their parents and when their parents know how to respond to them. Something else that can be really helpful is treating the parent and caregiver as a co-provider. So sometimes I like to refer to myself as a coach more than like a therapist. And so I talk to families about like, I'm here to like coach you in implementing these things at home. For example, like with exposures, that's not always something that we can do in session, and that requires a lot of effort and engagement from parents and caregivers at home. And so telling them that I'm your coach, you're going to come in and talk with me, but I need you to be a provider at home. That can be really empowering for parents and caregivers. Um, and then also just encouraging parents to follow through with the home action plan. So this might be changing parenting behavior. So if you're making suggestions about that, making sure that we're following up about it, and being consistent, making sure that families are following through with exposure exercises or supporting different coping strategies at home. This is often really important when kids aren't always fully bought into what we're asking them to do outside of session. And so it's really important that parents are able to help support them and encourage them using coping strategies or following through with their homework. And so by including parents in all of these pieces, they feel like they're a part of the approach to the child, helping support the child. Um, and then that also helps when kids are no longer in therapy, parents know how to support them. They feel like they can help support them without having a therapist or another service provider. Um, Providing emotional support is really important for encouraging engagement. So I mentioned this before, but providing some limited mild counseling for parents. So providing encouragement and affective support, providing this mild counseling, parents often become more aware of their own needs, and we can help them become more aware of their own needs and how that might be impacting the whole family system. Also providing validation for the parent's position. So not blaming parents for their limited engagement and unavailability, but instead exploring what are the barriers that are getting in the way of their engagement and what is challenging with them being available, and helping to provide support and recommendations for that. Now, along those same lines of providing emotional support, we also need to maintain boundaries as the child's therapist. And so if we're providing this mild counseling for parents, making sure that there's a time limit on it, like maybe they're allowed to check in for the first 10 minutes, but we're really going to prioritize the rest of the session for the child because that's what they're here for. And then also being aware of if mild counseling is not effective or the parents need more, then also referring parents to another therapist if they need. Okay, and I just realized the time, so I apologize, everyone. But just some other recommendations are helping parents with psychoeducation, and so providing them psychoeducation about their child's symptoms and behavior, that orientation to therapy, as well as developmental information, like what are behaviors that are expected or things that require support. And then encouraging parents to be involved in experiential activities. And we discussed this with role plays and modeling, being involved with therapeutic games, facilitating discussion. And then also acting as a consultant where we're assessing challenges, providing feedback, and also providing resources to families. And then being aware of the family's cultural expectations and needs, so beliefs, values, and roles. And these are a lot of things that we've already discussed with cultural expectations and needs, that therapeutic alliance, understanding our own perspective, as well as providing reflective practice and engaging in some reflective questions for ourselves. So how are our perspectives different or the same from the family, and how might this impact the family? Okay, I won't ask that question. This is just general ways to determine engagement. So we talked about like the behavioral of like homework, asking questions, being attentive during session, general affect, are they enthusiastic, interested, cognitive is what are their beliefs and awareness, those sorts of things. And then these are some examples of measures to measure some therapeutic alliance. But thank you all for attending this session, and I apologize for going a few minutes over. I did want to say that there are, if you have families that need any additional support, we're also offering a parent training group that's starting March 9th. There's also a webinar series for parents that we're offering over the next few months, and so there's more information about that. And then there's also a training being offered if you have young adults that need more social support and you're wanting to gain more certification and training. We also are offering a training in June. So you will all get these slides and you can review them. If I'm not sure if my email was already put in the chat or not, but feel free to reach out to me with any questions. I will put a few book recommendations in the chat because I know that was something that someone was asking. I might also add a slide to this PowerPoint with some book recommendations. So then when you receive the slides, they'll be on there as well. Thank you all for your engagement and coming. Somebody did ask about receiving your continuing education credits. There, I believe in the initial registration email that you received, there is a link for, I think it's like providing feedback or something along those lines. Someone else can jump in and yeah, let me know. But yeah, click on that link, and then once that's completed, then you can receive your CE credits. So again, thank you all so much.